Hi, hello, good evening, everyone. iMumz is back with another Ask Me Anything session, and today is the 126th Ask Me Anything session. And today we have a super amazing doctor and a very, very senior doctor, Dr. Dipak Ji, with us today. Welcome, Dr. Dipak Ji, to iMumz Ask Me Anything session, sir.
Hi, Ravi. Thanks for the good welcome. I'm
So,
sure
so
with your assistant, we are going to have a lovely session, and I hope I'm able to
definitely, sir.
fulfill whatever the
Definitely.
things are there.
Definitely, sir.
Yeah.
So please let me take this pleasure of introducing you to all the lovely pregnant women out there. So Dr. Dipak Ji, you can't believe Dr. Dipak Ji has brought 58,000 lives to this planet. So Dr. Dipak Ji, in his more than 40 years of experience, he delivered 58,000 babies, and he's currently the president of SOGOG, which is the Obstetric and Gynecological Society of all the societies of Gujrat combined together. We have Dipak Ji live from Jamnagar, Gujarat today with us. It's an immense pleasure to have you today with us, sir, with your vast experience and helping more than 58,000 families in your long career. And so today, Dr. Dipak Ji will talk about labor inducing. So for the first 10 minutes, Dr. Dipak Ji will enlighten us on this topic. Please utilize this opportunity and post your questions to Dr. Dipakji. This is going to be a fantastic session, and Dr. Dipakji will answer all your questions soon. Over to you, Doctor. Again, it's a pleasure having you with us.
Ravi, thanks for the kind words. I really acknowledge the iMum's application, Ravi, and also Dr. Jaideep Malhotra, who invited me for this session. Jaideep, as you know, was the vice president of a Foxy, our organization Foxy, a body consisting of about 40,000. Okay, she's a great doctor, but she's a great good friend also. And introducing me to iMumz is great. Let me tell you, Ravi, I'm really happy to be with all of you. Now you'll be surprised. Why did I really choose induction of labor? Because nowadays most of our patients must have heard that some doctors will ask them, would you like to get induced at some stage of life, or would you like to go for a normal delivery and wait for labor pains? Now, what is really induction of labor? This induction of labor is an artificial initiation of your labor pains. You are not getting your pains, but doctors try to get you artificial pains so that you deliver. Mind it, the induction of labor is for a normal vaginal delivery. Yes, it may land up in a cesarean section. That's a different thing altogether. But the idea of inducing you at any stage of your pregnancy, most likely at around 39 weeks, is so that you get a normal delivery. Why you need to deliver before the date? You see, when you went to your doctor earlier, the doctor gave you a date that you'll deliver around that time. You'll be surprised to know that only about 12 to 15% of the patients deliver on the date given by the doctor. Otherwise, it's usually 1 week here or 1 week after the date, most likely 10 days or 1 week earlier than what you expected. So now, at some stage of your pregnancy, last time, your doctor will ask you that you like to induce your labor. Why? The question will be there for everyone. While there are some conditions like diabetes, high blood pressure, your baby is weighing less than that expected, that what we call is a small for growth baby, where the blood supply to your baby is compromised a bit, or your water bag is busted. Now, these are some of the conditions which are must that you deliver earlier, because this is to keep your baby and you both quite well. This is not, now many say that last week, you see, after 39 weeks, the baby is compromised because sometimes the water, which is called as a liquor, reduces by itself, and the complications in the babies increases in the last week. So nowadays, very many gynecologists, including me, we advise our patients to get induced at 39 weeks. weeks. This is in line. And what of the literature says, if you see, you'll be surprised to know, the mind is always there. The doctor is inducing. So are you going for a cesarean section the next evening? It's not that. The statistics says if you are getting induced at around 39 weeks, the chances of normal delivery is more than your cesarean section. Because sometimes what happens at 40, 41 weeks, because the blood is compromised, your baby has some distress and you might have to undergo a cesarean section immediately. Like what happened yesterday. I'd asked a patient to come and induce at 39 weeks. Somehow, because of some issues in the families, an untoward incident happened. She ended up yesterday. She came yesterday, and what happened really? There was hardly any liquor. The liquor around surrounding your baby, what we call is the water, that is the respiratory part in the baby. And with no liquor at all, I had no option except to get her to a cesarean section so that baby was not compromised when she delivers. Suppose if I had waited, yes, she might have delivered, but I really don't know whether the baby would have been compromised or not. So if you really go towards the literature, all the evidence say it's better that you induce around sometime at 39 weeks. This is what the general trend is. Now, the question is, there is another indication. So like in corona epidemic now, this safety for all. Your doctors, the staff for his hospital, and you also, most of the doctors get the pregnant woman tested at around 38, 39 weeks. So they can induce her in a safe environment, nothing to be worried about. So, and another indication has been increased for indication now. We didn't have this COVID as indication, but now we get you tested around 38, 39 weeks and try to induce a week before that, unless in fact within a week of your last tested of COVID, so that it becomes safe for you, the doctors, and the staff. And if your hospital is safe, it means you are not going to have COVID also. So this is another COVID thing. You say, what happens? Why do you say the indications for induction? Do you know our ancestors are never wrong? They used to give us castor oil. Ask your grandmoms, ask your moms, or probably grandmoms, someone. Okay, why did you take castor oil at 38 or 39 weeks? The idea was the castor oil will help you to induce labor pains. This is one method. So if you consider that also, the induction, even by our ancestors, were advised by taking castor oil in the last 10 days or so of your expected date. The idea was to evacuate the rectum so that you have a good stool and everything is well. But castor oil also induces labor. So were our ancestors really feeling that we should induce at 39 weeks? I suppose so. So this is another thing. But do you think the induction is safe? The question will be there, of course, that whether the induction is safe or not. No. Any procedure, what you do, even with a normal delivery, it is a delivery at the end of the day. You need a healthy mother and a healthy baby. So whatever procedures you do, whatever you induce, even cesarean section, even a normal delivery, has a problem. It's not that we don't have problems. Sometimes, even the patients feel that we would like to deliver at this particular day. Yes, then most of you will think that doctors will do a cesarean section. It's not that. Suppose if you come to me or any gynecologist that you would like to get delivered on such and such day, because that is an auspicious day for you, and if the doctor feels, yes, your baby is healthy, and if you deliver, there might not be any issues, probably doctor may ask you to get yourself admitted and induce the labor. And mind it, induction does not mean cesarean section. And as I've been saying earlier also, the rate of cesarean section when you are induced at the right time is less than if you wait for the normal time to deliver yourself. The other indications like say blood pressure, hypertension, you have to get yourself induced because then you have issue with your babies. See, like suppose if I call someone with a diabetes, this is diabetes also is a pregnancy related diabetes. You don't have a diabetes earlier, but you get yourself tested at around 28 weeks, and then again at around 34 weeks, you find that your blood sugar level are more than 140 after having some glucose powder, about 75 grams glucose powder. So post 2 hours glucose powder, if you find your glucose high, you'll be worried what's happening to your baby. Yes, you need to worry a bit, but with a good gynecologist around you, I'm sure he or she will carry out the pregnancy up to 37, 38 weeks, which is a date for maturity, and then advise you either to induce, because suppose if I went along with a diabetic mother or a mother with hypertension, which is quite common, almost about 8 to 10% in the first time delivers, the chances are that something can go wrong with the baby. Or in some incidences when mother is having also a lot of blood pressure, vomiting, headache, we need to deliver quick so that both babies and the mothers are safe. Okay, I'm not trying to say that something is going to happen to you, but with the right dose of induction drugs, I'm sure your doctor will explain everything to you. And if you need, you can ask me any questions after this, and I'll be very happy to answer all your queries. But as you feel, induction doesn't come without any issues, as I said earlier. You may not get contractions at all. Then the doctor may say that, okay, just go home. We'll try to reduce again. Or if get admitted, and they will monitor you and your baby both. Sometimes the drugs work in a more way so that you get more contractions and your baby may be compromised. That time, either the contractions are decreased, or yes, you might end up in a cesarean section because the baby has to be saved then. You might have nausea, diarrhea, vomiting. These are some of the things which are part and parcel of any delivery procedure, not only induction. But yes, induction itself, if you say it's safe, as a normal delivery, it's not absolutely safe. I cannot guarantee you that if I induce you, you will have pains, or you will not have more pains so that body is compromised. But majority of patients, in my experience, where I've induced quite a lot, induction, if done in a proper dose, is a good method to deliver yourself if your doctor asks at 39 weeks or probably. In fact, after 40 weeks, yes, it is a must. Some people wait up to 41 weeks, but others may deliver you around 40 weeks. And any day more than your 40 weeks, suppose induction, this induction has to be a perfect date. And nowadays, as you all got your sonography done in your first month of pregnancy, we are sure of your dates. There's nothing wrong with your dates. Earlier when I was studying, we are just depending on our hands and our mind in your dates. At that time, yes, your sonography, your date may be wrong. The exact dates of your sonography, the exact date of your delivery is best and the only judge during your first 3 months of pregnancy. The next 3 months, you might not get your exact date, and the next sonography are never for your dating of your pregnancy, and they will never give you an expected date, exact expected date of delivery. Suppose if I do your sonography at last month, your exact date I can never say. I just have to depend on your clinical history. So the best for everyone is to get a dating sonography in the first 3 months of pregnancy, preferably first 2 months. See, then the difference will be just about 2-3 days by any measure. It cannot be more than that. But suppose if you want to get your dating sonography in the second or third trimester, that is from anything between 4th and 9th month, you will never get your date. I think, okay, Ravi, I'm open to the questions.
Thank you, sir. We are excited. Thank you so much for your wonderful, insights on such an important topic, which we get little information most of the time. So, wonderful ladies out there, please shoot your questions, and Dr. Dipak ji will take them. First question of the day from Lakshmi Kumari. She's in 20th week of pregnancy. In the TIFA scan, she got placenta posterior
Yeah.
and reaching up to the os. The doctor said low-lying placenta. What does it mean? How will affect me and my baby?
No. See, okay, you are just about 20 weeks. So by the time you reach up to 36, 37 days, most of the time your placenta is going to migrate. What we call is a migration of placenta, because the uterus goes higher, the lower segment will go. You don't need to worry. You are not going to have placenta previa, because it is just reaching the internal os. As your baby grows, as your uterus is growing, the lower segment is going to get bigger. I mean, the longer. You don't need to worry. 20 weeks, I'm not even considered that you have something. Okay,
Thank
30
you so much,
weeks,
sir.
serious come to 173.
Thank you,
Yeah,
sir.
that's right.
And
Anything more you wanted to say about placenta? Are you okay?
okay, I think this question has been answered, sir. Sir, my question, in many women we notice that, on a platform, that in the early pregnancy they fear about having low lying placenta, but it gets normal as the progress in pregnancy. So it is not
Yes.
something to be worried about initially.
That's what I said. There's a migration of placenta. But actually, it's not
Right.
a migration, but it's the uterus getting larger. And as the uterus
Right.
gets larger, the placenta is also going up. And this is, I
Right.
mean, the last lady who asked, it was just reaching the internal os. Suppose it
Right.
was, if it was covering the internal os, yes, then I would be worried. Not that much worried, because then you have to deliver the baby. But here I'm not worried for this lady. I'm sure about it.
Thank you,
That her
sir.
placenta is going to be.
Lakshmi, all the best. Thank you so much. Yeah. She wants to know more on placenta. Would you like to share more, sir, or do you think you
What?
have answered?
Okay, placenta is a mediator between you and your baby. The blood supplies goes to the placenta, and to the placenta it goes to your baby via the umbilical cord. This placenta, if it was really low down, the condition known as a placenta previa, then there is no question of induction also. Here we go for a cesarean section only. I'm not going to make you afraid, but I'm sure your doctor will take a good care of you when you are pregnant. Yeah. Only thing he or she may ask you to go for an earlier cesarean section at around 36 or 37 weeks, because he doesn't want or she doesn't want lots of bleeding at that time. Don't worry. Ask your doctor. Placenta. You don't have a placenta, so you don't worry about that part. Okay.
Thank you, sir. So nothing to worry, Lakshmi ji. Have a happy pregnancy and follow doctor suggestions. All the best. Riddhi has a question, sir. She's in 30th week of pregnancy and GCD has come 173. She have fibroids and she's on complete bed rest since beginning to end. Please advise what should I do?
Okay. 30 weeks, and as in fact I mentioned also in my induction, you are 37 years old. Okay. Fibroids are expected at this time, and as you have crossed around 36, I don't think the fibroids are going to have any more problems. Yes, you might have labor pains earlier, but once you have crossed 30 weeks, I'm not really worried. Yes, I'm concerned about 173. The first advice certainly would be a diet. No sugar, no sugar at all. You can't add any sugar, and you have to be very careful. You got to bring down this postprandial blood sugar to less than 140, and your fasting blood sugar to less than 100 if possible. If not, there are some drugs to get your sugar down, but then you'll have to monitor your blood sugar. If you've got a glucometer, please do it every day at home, fasting and post a meal. You got to make sure, and I'm sure with some exercise, the diet, good diet you got to take. Make sure that you don't have any sugary syrups, sugary drinks, and no added sugar also in tea or coffee. 173 probably can come down with your lifestyle modification and the diet. But if not, please don't worry about it. There are drugs. Probably with metformin, you may be controlled. You might not have to be put on injectable. But the main thing is your sugar level has to come down. Vidhi, I'm sure you've crossed 30 weeks. Don't worry. Is this your first pregnancy? 37, and is this your first pregnancy?
Sir, that detail was not mentioned. We don't know if it's a Riddhi's first time pregnancy or not. So would
No,
you
that's
like
fine.
to?
But I mean, her sugar has to get down first with the diet and then with medicine if required, but that is a must. Fibroids, I'm not worried.
Okay, it's a
Okay,
first
Riddhi, that's
pregnancy,
fine.
Riddhi, as
Don't worry.
mentioned.
Just make sure that you control your diet. Some exercise, very moderate exercise, not very hard exercise, but at least walking part can you do. You can do some breathing exercise. Avoid direct sugar. No direct sugar also in your tea, and of course no sweet. If you are having a sweet tooth, you got to ignore it for at least next 3 months or so.
Thank you so much, sir. Riddhi ji, hope you're following iMumz application, all the healthy recipes and all the exercise and meditation exercise there. So have a happy pregnancy as Dr. Dipak ji has suggested. Next question, sir, we have from Sneha. She had scan yesterday that in the 11th week of pregnancy, the baby is 4 centimeters in length. The doctors said at 13th weeks we will do anti-scan. Is the baby okay to have a 4 centimeter length?
Okay, Sneha. 4 centimeters is the right thing at 11 weeks. The anti-scan, what we say, is a pre-examination so that you don't get something like you have, some markers. An anti-scan is one of the markers to see that your baby has no issue at all. And this marker, anti-scan, is best measured when your baby is about 4.5 centimeters to 8.6 centimeters. So this is the range, say around 11 to 14 weeks. But as your baby is just about 4 centimeters, I'm sure they'll do your anti-scan after a week or so, and then you'll get your anti-scan. And then they will also get your uterine Dopplers, and they will see for the baby's heart also. This is in thing now, and this will help to see whether you are going to have an issue with your baby later on or not. So 4 centimeters is absolutely fine, Sneha. No issue at all.
Thank you so much, sir, for that answer. Sneha, as doctor said, no worries. And you can also check in the iMumz app what is the ideal length of your baby at different stages of pregnancy. And you can also bond with the little one using the exercises we put in iMumz app. So have a happy pregnancy and thank you so much for answering, sir. Riddhi, whose
Ravi,
question?
before you ask me, I went through the iMumz application. It's fantastic. Let me tell you. Even some of the things I'm happy to learn. Let me tell you. You have collected it so well that even after so much of experience, I think if my wife gets pregnant again, I'm sure I'm going to ask her to look into iMumz application and follow what you people say. It's really great
Thank,
application.
thank you so
Ravi,
much, sir.
great job you are doing for all the pregnant women.
Thank you, sir. I think it's a big honor to learn from you, from your experience of delivering 58,000 babies. So I was having a chat with Dr. Dipak ji, and I told sir I came from a place where the population is 10,000. So Dr. Dipak ji has delivered, I mean, in his vast experience, whatnot, he has seen all types of cases, all types of possibilities. So thank you so much, sir. It's an honor to listen from you. Appreciation from
No,
iMumz.
no, Ravi, the compliments are you people also. Yes, if JGP has encouraged you to do this thing, I mean, it's really congratulations. This application is great application, let me tell you. It's
Thanks a
going to
lot,
help a
sir.
lot of people.
Thank you, sir. Moving to the next question from Gauri. What is the reason for an embryonic pregnancy?
Okay, embryonic pregnancy means that pregnancy is not going to go further. The embryo was not formed at all. You must just have a gestational sac, and this happens is almost 15% of the patients. If this was the first time you missed a pregnancy, what you call as a blighted ovum, please don't worry. It happens in 50%. Consider this like an accident which was not expected, and move further. Try to get yourself pregnant again within, let's say, next 6 or 8 months. Yes, I would be worried. I would not like to have an embryonic pregnancy, but it happens in 15 to 17% of the patients, and that's what is there. See, in a pregnancy, if I give you statistics, you lose about 17 to 20% pregnancy within the first 3 months, another 10%, about 7% in say 4 months to 6 months, and I'm not going to make you really frightened, but I will say even in the last months of your pregnancy, even at the time of your delivery, some babies do not cry. These are the statistics and some of the things which we really can't help. So, in embryonic pregnancy, Gauri, yes, I will be very disappointed. but then I'll be happy also to say that both of you are normals. That's why you got pregnant. Forget this pregnancy. Yes, you can't forget it easily, but try to forget it and move ahead. Try to plan your pregnancy. Check your folic acid, check your vitamin D, check your vitamin B12, and try for the pregnancy just within the next 3 or 6 months. This is just an accident which has happened. So it's better to forget about it this as soon as possible. Yes, if this was your 4th or 5th time you lost a baby, then there are quite a lot of investigations, which I'm not going to talk about now. But for you, Gauri, consider this as a bad accident. But as I said, the positive is that both of you are normal. That's why you got pregnant. Okay, move on, Gauri. Best of luck for the next pregnancy.
Thank you, sir. Wish you all the best, Gauriji, and thanks for telling in such a positive way, sir. Thank you so much. Rutuja, today she got her blood report and it's showing TSH 19.07 M. She completed 9 weeks of pregnancy. Can it affect the baby? Please suggest.
Yes, TSH 19.07 is fine. It can affect the baby if you don't take thyroid medicines. So your doctor, I'm sure, Rutuja, is going to prescribe you some medicine so that you get your TSH level low down up to 2.5. The best part is we have medicines. And I really don't know whether you had done your TSH before you got pregnancy. But anyway, at the moment, there are medicines which will get your thyroid level, TSH level 2.5 or below that thing. Don't worry. You've been diagnosed at a very early stage. Nothing is going to happen to your baby. Don't worry at all. But yes, you will have to take your thyroid medicines, get yourself TSH done every month or so, and adjust the dose. But suppose if you are adjusting your dose so that your TSH remains say between 2.5 and 3, I'm sure nothing is going to happen to your baby.
Thank you, sir. Richa Maheshwari has a question. She asked this inside the iMumz app. In 27th week of pregnancy with DCDA twin pregnancy, her fetal GA is showing 28 weeks and 5 days. How can EDD be calculated? As per GA or as per fetal GA?
28 weeks, I'm not going to say EDD at all. There's no way. Especially in twins, because one baby may be small, one baby may be big. Did she have a scan at the first trimester, the first 3 months of pregnancy? Otherwise, I will have to just depend on her last LMP, if she had irregular periods. But to calculate an EDD with 28 weekers twins is almost impossible. No. Because I might be wrong around, say, almost anything between 2 to 3 weeks. That's the importance of a scan earlier.
Thank you, sir. Geeta's question, she's having multiple fibroids. Can she get pregnant? Any chances for shrinking fibroids naturally,
Yes,
please?
there are some medicines which shrinks fibroids to some extent. But if they are more than 4 centimeters or 5 centimeters, you need to remove them before you get pregnant. It also depends on the position of your fibroids. Suppose if the fibroids are the outside your uterus and they are not inside, not in the muscles or in the endometrium, then they are the best things. But any fibroids more than 5 centimeters per se, you'll have to remove them before you get pregnant, unless they are outside the uterus. Suppose if they are not getting, your uterus is not being disturbed, then it should be fine. I think how many fibroids you have? Multiple fibroids, small size fibroids, you may try. And suppose if you are about 30 or 35, I think please remove your fibroids before you really plan a pregnancy. If they are a large size also. If they are small size, forget about them.
Thank you, sir. Next question by Chandrakala. Namaste, doctor. During pregnancy, milky white bleeding, is it normal or not?
So this white discharge is quite normal. If it is not giving you some itching, it's not a foul smelling discharge, so that's fine. Suppose if it is a foul smelling, your knickers get painted with a white discharge and it is copious, then you need to see your doctor, because there can be lots of white discharges in a different thing. You might be having some fungal infection, you might be having a bacterial infection, which needs to be treated. But if it is a pure white discharge, no itching, not disturbing you, then it's fine for some time. But I think for a white discharge, it is always better to consult your doctor and ask him or her for the treatment, because white discharge, if it is infected, can get you into a premature labor and you might abort also. So white discharge, yes, 80% of the times nothing happens, but suppose if it is a really severe infection, it can go for a premature labor pains also. So I think here I would really advise you to consult your doctor. He or she has to examine you to make sure that your white discharge is a normal discharge or an infected discharge.
Thank you, sir. Next question by Anjali Patil. I have left side abdomen pain. Is it normal in the second trimester?
Uh, if the abdomen pain has been since long, that is normal. If it comes, and it continues for next, say about 12, 6 or 8 hours, and you are not relieved, then probably it's not normal and you need to see a doctor. But if it is there, the left side, is mainly is the colon. I hope you are not constipated. Make sure that you pass your stool daily. If you have to take laxatives, say like isabgol, the best would be green leafy vegetables. Make sure that you are having lots of water, and at least you pass your stool without pain. That is very important. Otherwise, don't worry about that thing. I don't think it's not in the second trimester. It can be any time also. But left side pain will be most likely with your digestive system, and see that at least what you are passing is a normal stool. Otherwise, you try to take a laxative so that it does not fit. And laxative like isabgol is quite okay. But mainly you go to concentrate on diet. Are you having almost about 2 liters of fluid every day? More of green vegetables. That is very important.
Thank you so much, sir. One second. Sorry, I missed the order. Next question we take from फेमिना. इनका सवाल है कि डॉक्टर मुझे वजाइनल पेन होता है 30th वीक चल रहा है.
Femina, is fine. It should be okay. Because the baby is moving down also. So sometimes you have that kind of pain, which I feel is quite okay.
थैंक यू सर. फेमिना जी, डॉक्टर दीपक जी का ये कहना है कि जब बच्चा नीचे जाता है, मूव होता है 30th वीक के बाद, तो ये होना नॉर्मल है, तो आप चिंता मत कीजिए, ये नॉर्मल है, ये कह रहे हैं डॉक्टर. Kinjal Shah's question, sir. 27th week of pregnancy, she's having a lot of itching around the belly button and the surrounding area. What should she do about?
Okay, Kinjal. Yes, itching, in fact, around umbilicus or belly button, as you say, is quite common. In fact, itching in pregnancy is common. Only thing is, you make sure that your skin is not dry. Try to use any moisturizing cream. You don't need to go for a hi-fi creams which guarantee you there are no stretch marks or something. No one in this the world is going to stop your stretch mark, because they are really not a stretch mark. They are just stretching of the abdominal fat and the muscles. Main thing is use any moisturizing cream. In fact, simple things, even a liquid paraffin, you don't have to go for a fancy things only. Make sure that your skin is properly moisturized and the skin is not dry. It should solve your problem. But suppose if it is in a belly button, only thing is because sometimes you don't clean the belly button properly, especially with the pregnancy, that it gets stretched. So make sure at least it is quite clean. Run it with a mild soap water, and then try to use any moisturizing cream. It should be quite fine. I'm not worrying about this thing. Unless it is reddish. Suppose if the whole surrounding area is pinkish or reddish, that means it is an infection. Suppose if that is the cause, then you go to see a doctor. If it is just simple itching, no reddish part around your belly button, don't worry. Just use a moisturizing cream. After making sure that your belly button doesn't have some particles inside, you go to really clean it with a good soap and water. I hope that is okay with you, Kinjal.
Thank you, sir. All the best, Kinjal ji. Have a happy pregnancy. Next question, sir. Richa Maheshwari, she has a follow-up question. She earlier asked about EDD with twin pregnancy. Now she's saying that during the first trimester, the EDD was 12th November, and in the second anomaly scan, the EDD was 9th November. And
Forget
yesterday
it.
she had
Oh, sorry.
And she had color Doppler test and the EDD showing 3rd November. The cervical length is 43 mm and both her babies have cephalic presentation.
The first EDD, first trimester EDD, as 12th November, I would put it as a right EDD. Forget the, in fact, I told you earlier also, the EDD is, the dating scan is the first 3 months. If your dating scan says the date is 12th November, and 9th November, 10th November, 12th November, and 5 November is really not a difference at all, frankly. As I said, you will deliver anytime 10 days plus, 10 days minus or 10 days plus. So I would really not worry because, see, the first trimester scan showed your date as 12, was it 12th? Yes. So second scan you went was a 9th, and the third scan you went is 5. So it's almost the same. Don't worry about that thing. But yes, your EDD would be 12th November. But with twins, I expect you to deliver earlier. I don't expect you to go up to the last months. In fact, I would advise you to get induced at around 37 or 38 weeks, because what happens is the blood supply to both the babies are compromised at the last 2 weeks of pregnancy. So probably your doctor also would ask you to induce you at around 37 or 38 weeks. Hopefully have the best time with your 2 babies. I'll be very happy to see them.
Thank you so much, sir. All the very best, Richa. Next question by Sabitri. She's in 31 weeks of pregnancy and she's facing breathing problem while going to bed, and after some time she didn't feel the same. Is it required? Medication is required for this condition? She's asking.
30-week pregnancy, because your abdomen is right up to the chest, yes, you will feel some breathing problems. But if this breathing problems continues, are these breathing problems when you are walking or when you are doing some strenuous work? Because if it is so, then you go to see your physician to see that your heart is quite okay and you don't have any heart issues. Because at 32 weeks, most of the times people get breathlessness, but they don't compromise with your work. If your breathlessness is compromising with your work, that you can't even do your routine work like cooking or something, then I think you require to see your doctor immediately. Medications, if required, 95% of the times you don't have anything. If your breathlessness is not disturbing your routine work, or if you are not really getting tired after, say, a walk about 5 or 10 minutes, then I don't think it's really need to worry. That's why breathing exercises are very important during your antenatal period. You make sure, suppose if someone is going to ask me, so what would you advise? I would always say, make sure that your breathing exercises, because those breathing exercises are going to be very helpful at the last time when you are going to deliver. So if the breathlessness is not incapacitating you, then there's nothing to worry. But still, I would really consult a physician to see that there's nothing wrong with your heart or lungs.
Thank you, sir. Thank you, sir. All the best, Sabitri. Next question from Preeti. She's 25 weeks pregnant, and today suddenly there's bleeding during bowel movement, but no pain. What should she do? She's taking soft foods and having buttermilk.
Okay, pregnancy, suppose if it is with the stool, that means you might be having hemorrhoids, or we generally call as a piles. So this is one of the things. It can be quite a lot. Here you go to, I hope this bleeding didn't come from your vulval part, and it came through your rectum where you pass the stool from. Because both the treatments will be different. If it is passing with the stool, that means you might be having a piles. But if it is coming from the upper side, from your vagina, then you have to consult an obstetrician immediately to see whether the placenta or something else is not there coming down. But as you are saying, you are already taking a soft food, having a more buttermilk. But make sure that you check up with your surgeon to see if there are no piles. And the treatment what you are taking is absolutely correct. But you go to identify this bleeding sometimes, because you are not able to identify the bleeding. Where is it coming from? Is it from your vagina or is it from your rectum? If you are sure it's coming with the stool, then I will be thinking to go to a surgeon and see what treatment they can give you for the piles or some ulcers at that time. But yes, bleeding, I think you got to consult your doctor. Please don't take your home medicines here. Okay, must be piles, Preeti. But please see your surgeon. I'm sure he will advise you better. Yes, softer thing is okay.
Thank you, doctor. We wish you all the best, Preeti. Next question by Meghna. She's in 24th week of pregnancy, and the first question is,
Okay,
I have only took TT injection and not visited a doctor yet. Is there any other injection mandatory to
no,
take?
no. Suppose if you are tetanus toxoid is another. If you have taken both the tetanus injections, that should be fine. But nowadays also, your doctor may prescribe you instead of only tetanus, you might be prescribed TDAT, which contains of also pertussis and diphtheria. But you got to take second injection of tetanus if you're not taken it by now.
Thank you, doctor. Mansi's question. She's suffering from
Extreme
extreme cough third month, especially in the
third month, if it is occurring every day, I would really certainly advise you to see your physician. I mean, you can't have it every day. Yes, for a couple of weeks that should be fine. But otherwise, you need to see a physician to see there are no infection in your lungs or somewhere else.
yeah. Thank you, sir. Meghna has another question. 24th week of pregnancy.
Okay, infection in vagina. It can be a fungal infection because pregnancy is a precursor for infection, yeast infection. So for yeast infection, the curd is okay. Home remedy is applying coconut is okay. But that fungal infection has to go. So you got to take some antifungal ointment and the tablets. Please visit your doctor because here, if you don't get yourself treated with your fungal infection, there are chances that you might go for a premature labor pains. You can't take this infection lightly. Just try your home remedies. That is fine. But this fungal infection has to be treated in a proper way because there are problems with a premature delivery in such patient. Yes, it happens very occasionally, but there are incidences. So please visit your doctor and take the antifungal treatment whatever he or she suggests. Best of wishes, Magna.
Thank you, doctor. And
Yeah.
Anirnita, her question 4.5 cm cyst and 11 weeks pregnancy.
If the cyst is just 4.5 centimeters and if it is a clear cyst, nothing to worry about. Forget it. It will just disappear. Your
Thank
miscarriage
you.
not because of your cyst, that's for sure. And as you have crossed your 8 weeks and 11 pregnancies, so I don't think there's a. But you got to keep your size of the cyst measured. 4.5 cyst, 4.5 centimeters. I'm not really worried.
Thank you, sir. All the very best, Anirnita. इनसी आज a question. इनका सवाल है कि मुझे 3 मंथ कंप्लीट हो गए हैं बट मुझे नाइट में बहुत ज्यादा प्रॉब्लम होती है टू मच ऑफ वीकनेस एंड
ये घबराता
जी
है
जी घबराता है
जी
ओके
घबराता
प्लीज
है और रहते हैं से 3 महीने में तो ऐसा होता ही है आप कितने बजे खाना खाते हो बताओ मेरे को रात को 8 बजे से पहले आपको खाना खाना चाहिए और रात को 10 बजे के बाद अगर फ्रूट्स ले लो कुछ दूध वगैरह ले लो और 3 महीने के अंदर तो जो भी खाने में वॉट एवर यू फील लाइक आप जो भी खाना मांगते हो वही खाओ डोंट फोर्स योर सेल्फ और आपका लंच और डिनर कितने बजे लेते हो 3 महीने में तो क्या है कि आपका फुल स्टमक भी होना नहीं चाहिए और भूखा भी होना नहीं चाहिए थोड़ा थोड़ा सा खाओ दिन में 4-5 बार खाओ और रात को सोने के टाइम थोड़ा सा फ्रूट ले लो और गर्म दूध ले लो ये ठीक हो जाएगा वीकनेस इज नॉट एन इश्यू आपको 1 महीने बाद 3-4 महीने के बाद ये इशू चले जाएगा आफ्टर 4 मंथ्स ये चले जाएंगे डोंट वरी
थैंक यू सर ऑल द बेस्ट इंसिया जी आप कोशिश हम वो करते हैं कि आपका ये जी घबराना जल्दी ठीक हो जाए और दीपक जी ने इतना अच्छा सलाह दिया आपको Shelly's question, how many ultrasound need to be done in the whole pregnancy? I think Shelly, we have lots of videos inside the iMumz app, but we'll request Deepak sir if he wants to cover this shortly.
So yeah, as I said, the first dating scan around 8 weeks, 11 to 14 weeks for NT and other markers, around 20 weeks to see for all the organ development, and another one at 36 weeks or 37 weeks to see whether your baby is growing well or not, and your blood supply to the baby is quite well. I think it's covered quite well in iMumz application. Just go through that also.
Thank you, Doctor. Shaili, there are so many videos you can see क्योंकि ये बहुत लंबा टॉपिक है. There are so much in detail explanation. हम आपको रिक्वेस्ट करते हैं कि आप प्लीज एक बार देख लीजिए. Bona's question, she's in 10th week of pregnancy. She's having wet cough with sputum, but it's very light. Is it normal in early pregnancy?
I mean, no cough with sputum is normal. A dry cough, I would say, is normal because you are getting your throat irritated. But if it is with a sputum, that means that there is a bacterial infection. No, you go to see your physician for this thing. And suppose if it's lasting for more than a week, I'm sure you go to see that. Dry cough for about 6-7 days, I would agree. But with sputum, I think it's a bacterial infection. You go to see your physician, even if it is light.
Thank you so much, doctor. Next question. Meenal has a question. She has severe pain in the left side of the groin area. It's a sharp muscular pain, especially when she gets up or turning sides. What can she do?
I don't know. I mean, what is the duration of your pregnancy? Are you almost near to a full term? Then this thing can happen, especially getting up. I mean, except for getting up very lightly, make sure that you sit on your bed for some time, move your legs, see that you are comfortable, and then get up. Don't try to get up directly from the bed immediately. Even if you're turning sides, try to sleep on the left side if possible. Even if you're turning sides, make it very slowly. Don't have jerking movements which can affect your leg muscles. And don't get up fast. Wait for at least 3, 4, 5 minutes. Loosen your limbs before you really get up.
Thank you, sir. Next question we have from Deepti Gupta. She's 36 weeks pregnant. What is that baby passes meconium in the womb? What is the reason? She lost first baby full term 40 weeks after C-section delivery because it's swallowed meconium.
See, the passing of meconium, that means the baby is distressed. See, this is like, suppose if I am pressing your neck tightly, or trying to hang up, what will you do? The first thing is pass your urine and pass your stool. So this is what is happening with your, what probably happened with your baby at that time. That's why, my topic today, if you see, I said, these are the incidences which you want to prevent. That's why we try to induce you at 39 weeks. Because at full term, the liquor, the water gets decreased, the blood supply to your babies get decreased. So this is the reason you get a meconium and the baby swallows it and this happens. So probably don't worry, probably because you have earlier cesarean section, I'm sure your doctor is going to advise you a cesarean section just about say a couple of weeks down the line now, around 38 or 39 weeks. And please agree it immediately because he or she probably would not like to take a risk with your baby at this time. So be prepared for being a mother, say, within next 10 days or so.
Thank you, sir. Samiksha has a question. This is her second pregnancy. She have short cervix of 25 detected at 22 weeks, and currently she's in 31 week. The cervix length in the first pregnancy was also this much, but she had a premature delivery.
Okay, suppose with the history of your first pregnancy being a premature delivery and 22 weeks, it was detected was 25 millimeters. Was ischemic encerclage or a stitch around the cervix advised to you at that time? I'm sure it must have been. Suppose if it has not been advised at that time, that's fine. You already crossed about 31 weeks. So visit your doctor. She might give you some injections of progesterone or some tablets of progesterone which may prolong your pregnancy. You go to see your doctor.
So she also mentioned few
Okay,
details.
this is oligohydramnios. Yeah, you get duodenal probably will not help. Sustain is okay. The progesterone is okay. Duodenal is not really going to help you much. But yes, sustain will help. That's why I said your doctor is the right judge. The first pregnancy was because of oligohydramnios. So it doesn't concern you now. Don't worry about that. Continue your sustain till 36 or 37 weeks. You are fine.
Thank you, sir. Archana Singh's question, she's getting very sharp and sudden. Calf muscle cramps, generally in the right leg during her sleep. She have to suddenly get up, still feel helpless, even after standing or changing the leg position in 30th week of the pregnancy.
No. Okay. I mean, the muscle cramps are quite common. Are you sure that you are having adequate vitamins with you? And if the muscle pains are really incapacitating you, I think I won't be able to really give you a good advice without examining you. You got to check you with your doctor.
So she's also having a lot of gas post dinner and she's not able to
Okay.
sleep.
See, the main issue what I have found with the post guest dinner, because the dinner is very light and a heavy dinner. I would always advise have 3-4 meals a day, divide your meals, leave the dinner part with the minimum of food. You got to have more of breakfast, lunch, the mid break, the afternoon break, and dinner. I would really advise you to take before 8 o'clock, so that at least you have 2 hours or 3 hours before you really go to bed.
Thank you, sir. Thanks for
Sumi, that's
the
fine.
advice.
I think that's fine. She might be having some leg pains, but make sure that you are having your B complex and those vitamins properly. Check your vitamin D3 also. Sometimes vitamin D3 is less, and you might be given vitamin D3 tablets to cure this also.
Thank you, sir. Bharti Pachori, she is in 32 weeks of pregnancy and her AFI is 13.1 and the cervix length is 4.2 centimeters. The report shows early fetal-placental insufficiency. Doctor suggested her to take Herman drip 5 times. Is it necessary or can she go for Herman sachet? Or as of now, she's taking RG Break sachet, and from the last 2 days, she's feeling pain in the back, similar to the period pains. Is it a sign of preterm labor? And she's not having
No,
TB or any other complication. Can she deliver
see,
naturally?
this is because your blood supply to the baby is less. This is compromising your baby. So you might have to repeat your Doppler every week or every week and see that baby is getting enough supply. Liker may be help with some arginine or not very sure, because the main cause is placenta. Is she having a blood pressure or a diabetes? Because if the blood supply to the baby is compromised, you might have to get delivered earlier, so that the baby then can be taken care of in a good neonatology unit. And nowadays, the fantastic neonatology care centers, because such babies are better out than in. The blood supply is compromised.
Thank you, sir. Hello, sir. If any pregnant woman can bend and lift weights.
Bending, I would not really advise for any woman. Forget the pregnant woman. It is always better that you give some pressure. Try to get up. Suppose if you really want to pick up something, try to bend your knees. Try to keep your back straight and then lift up your things. Because bending can cause you lots of problems. Suppose if you are bending directly, it's difficult. Try it both the ways. Don't bend much. Try to use your knees. Bend your knees and then try to pick up.
Thank you, sir. Pooja's question. She's in 6th month.
Puja, that's fine. You will feel the baby within next 10 or 15 days. Some women don't feel it at all, but 99.9% you will start feeling your baby's move. And the first kick is going to be an experience. Let me tell you. Today only I received a telephone call from my nephew's wife that the baby has moved. She was so excited. So I'm sure, that is going to be a great experience when the first baby kick comes. I'm sure
Amazing.
it's going to come within next couple of weeks. Don't worry.
Thank you, sir. Thanks for this beautiful explanation. Please let us know, Pooja, share your best moment with all of us at iMumz app in the feed section. Would love to know. Next question by Lakshmi. She is in 4.4 weeks and she's having anxiety. She's feeling more hungrier than usual. Since she got to know that she's pregnant, but she stopped feeling hungry after 1 night of anxiety, will it affect the baby?
Don't worry. You have enough nutrition in your body to take care of your baby. 4.4 weeks. Don't worry. Just that means you are just about 4 days past your last period. See, the first 3 months are anxious. Yes, I agree. But try to think another 8 months ahead. how you are going to play with your baby, how you are to be happy. You know, happiness is the key to all your pregnant problems in pregnancy. Try to be relax yourself, move out, eat whatever you feel like for the first 3 months, except for the outside food. Yes, whatever you want to prepare at home, I'm fine with it. But happiness and your mindset is the key to the happiness in pregnancy. And mind it. If you are happy, your baby is going to be happy. Try to talk to your baby once the baby grows around 5 months, and you are going to get a response. Let me tell you, baby is going to recognize your voice only as soon as she is delivered or he is delivered. Happiness.
Thank you, sir. Thanks for that wonderful explanation. We wish you all the best. And also, we have such a beautiful baby care program inside for you, which will help you meditate every day, relax with calming ragas, and how to talk to your baby, and many moral stories. And of course, some doctor just commented that iMumz app users, they just saw that Dr. Dipak Ji is coming. Dr. Atil Luthra has commented that iMumz app users are lucky to meet the best obstetricians and gynecologists of the country. So stay positive, stay calm, stay
Say
relaxed.
hi to Aarti. Say hi to Aarti on my behalf.
Hi, Dr. RTG, Dr. Deepak ji is saying hi to you. So one last question we'll take for the day. So if you have any questions, we are very blessed with to have very senior doctors like Dr. Deepak ji with us. It's such a nice session it was. So please feel free to ask all your questions. So one last question of the day from Ananya. She's into 5th month of pregnancy. What should be the baby's heartbeat? How to consider anomaly report is normal or not?
Anomaly means if anomaly report, that means they will check everything, whatever is possible to be seen. They might check your baby's heart. Your heartbeat should be around 160 per minute. That's fine. Don't worry about that thing. It's not a question of only heartbeat. It's a question of whatever there is in the heart. And heart is one part. Anomaly will scan will cover everything, right from your foot toe to your brain. And please leave that thing to your the experts. Once your experts and your gynecologist say that baby is quite okay and normal, forget asking more questions because that means the baby is normal. And some of the things, even in the best hands of sonography, can be missed. At the end of the day, the person who is doing is an expert, but still is a human being. And there are limitations of what we can do and what we can see. See, the structural part we can see. There's a brain, yes, is normal. The heart is normal. But what is going to happen in your brain, whether the other part is there, no one is going to tell you. But look at the statistics only. 99% of the babies are normal. So why should your baby be abnormal? And if your doctor at 5 months has said your baby is normal, please consider that as a word of right and carry on. Be happy, as I say. Happiness is the key to a good pregnancy. The exercises, the meditations, the good food, all helps.
Thank you so much, sir. It's been a great session. You filled us all with positivity and handled all the questions and gave your expertise. We are very, very lucky to have you today with us. So please, let's thank Dr. Deepak ji for his time. There are so many more questions, but unfortunately, we can't take any more because of time scarcity. Thank you so much, everyone, for joining. We'll be back with another Ask Me Anything session tomorrow from 6 to 7 p.m.
No, before we leave, I would request the participants to give 3 cheers to Ravi and his team, Dr. Jaideep Malhotra, to have thought of this kind of application. I wish we had this kind of application earlier also. I mean, it's a boon. Let me tell you, Ravi, all the congratulations, and I'm happy that you are doing a wonderful job. And please keep on doing it. Even if I'm not with you, please keep me updated. I'll be very happy to join you anytime again. And I'll be seeing your things also on YouTube. I'll be following you quite. I'm not going to leave you, Ravi.
Thank you, sir.
You've been a wonderful communicator, and you are doing a great job for our pregnant woman. Let me tell you. Thank you very much. In fact, I am thankful that you gave me this opportunity to be with all of you. Yes, a special thanks, of course, to Jaideep Malhotra. She's a friend, so that's fine. Thank you.
Thank you so much, sir. Together, all the doctors are together for creating a healthier and happier future generation. So, we are thankful to all the time such senior doctors are giving. So, stay calm, stay positive, and stay happy. Thanks again, everyone, and a very, very special thanks to Dr. Dipak Ji. We would love to see you again sometime soon, sir. It's an honor
No issue.
hosting.
Anytime, Ravi, for you. Bye bye.
Thank you so much, sir.
Bye bye.
Have a
Thank
great day.
you.
Bye.
Leaving you now with all the